Hello, Blank board members. Today I'm going to give you a very short update, and at our board meeting on Tuesday, Dr. Woods will give a live update on some of our provider activity. But here we are, it's now spring and 2021, and already we can tell this is going to be what I'm going to call an upside down year. Our winter was like our summer. There was virtually no infectious disease, no influenza, no RSV, and really it's now just the end of March and the beginning of spring that we're starting to see some of those exact diseases now start to reemerge as our children are out there mixing and back in school and in daycare again. So even though we had very low volumes on the inpatient side in our pediatric emergency department, and those are just coming back, it's been just the opposite in some other areas. For instance, behavioral health has had record volumes and demand, as have physical therapy, occupational therapy, and speech therapy. As well as our STAR and developmental clinic, all of whom have been very busy. So what's our crystal ball? Our medical utilization is usually a product of two things, biology and behavior. Biology hasn't changed, except that we've added a new disease that will be endemic now for the foreseeable future. Behavior has been the major driver of our low volumes, and as we see people start to get out and mix again, schools are opening them up, we're starting to see all of our normal volume come back, including broken bones and infectious disorders. If you look at how our Unity Point as a whole is planning to manage this from a leadership standpoint, I'm very proud to say that Clay Holderman, our new system CEO, and David Stark, our regional CEO, have both made it very clear that we're in this for the long haul. We're not going to be making big changes that will affect our ability to manage all the community need when that need comes roaring back, which most of us anticipate that will happen. So they've made good on that promise, and that's the way we're proceeding. Lastly, I would like to talk about this is March's Social Work Week, and I met with our social workers the other day, and as you might imagine, the pandemic has impacted their workload incredibly. They've been another part of our frontline workers, and I sat down and had lunch with them yesterday and just wanted to pass on one of their observations. They said that one of the lifesavers for them has been the Compassion Fund and our financial advisors. They use those two resources virtually every day for our patients and families. And when they talk to their colleagues at Mercy, at Broadlawns, and even the University of Iowa, they say they don't have those resources, at least certainly not to the degree that we have it here in Blank. And they are very thankful for that support because it all comes from philanthropy. It's another way that you and the community make a difference. Oh, and I will add one last thing, a little update on Shriners. I'm filming this on Tuesday, a week before the board meeting, and this afternoon I'm meeting with Kristen Moore. Kristen Moore is our facilities individual, and our Shriner staff, provider staff, and we're going to be talking about our space needs already, how we're going to need to grow our capacity in the Shriners Blank pediatric orthopedic clinic. I have to say this is the first time in my almost 20 years that we've had to talk about expanding space before we even finished the first year of a new project. So we'll see you all next week. Dr. Woods will be giving you an in-person update, and we'll see you then. Thanks.